If your cycle feels like a mini health crisis every month, whether it's cramping, bloating, extreme pain, or even the heavy bleeding that often goes along with it, you're not alone. It's very common for women to have these health concerns, but it's also not normal, and it is your body trying to tell you something. So let's dive into some of the root causes that could contribute to painful periods. Check it out.
I'm Mariah, and I help women take control of their PCOS and insulin resistance. With over 8 years of university education and a naturopathic medical degree, I've guided hundreds of women to take control of their health. And if you want more practical tips, make sure you hit that subscribe button.
So unfortunately, painful periods often get brushed off. People will say it's just a part of being a woman. But here's the truth. Your body's trying to tell you something. Cramping, clotting, heavy periods, and pain are often signs of hormonal imbalances, inflammation, nutritional deficiencies, insulin resistance, or other medical conditions. Let's walk through the most common contributors to painful periods. Inflammation is often at the core of many painful periods. Your uterus produces chemicals called prostaglandins, and these hormone-like chemicals help it to contract so it can shed the uterine lining. But too many inflammatory prostaglandins can cause excess pain and cramping. And common drivers to these inflammatory pathways can consist of processed foods, high sugar intake, poor gut health, chronic stress, and insulin resistance. And yes, your blood sugar, metabolic health, and insulin resistance absolutely plays a role in period pain. Insulin resistance actually increases inflammation in the body, and it stimulates your ovaries to produce more androgens, which are those male hormones such as testosterone, which can lead to other hormonal imbalances. And this can often show up as PCOS, so polycystic ovary syndrome, irregular cycles, sugar cravings, and potentially some weight gain concerns as well. Another key factor are nutrient deficiencies. Your uterus and your entire body needs nutrients to function properly and optimally. And specific deficiencies in vitamins and minerals can worsen cramps and moods during your period. And common vitamins and minerals that need to be at optimal levels include magnesium, B vitamins, iron, and vitamin D. Magnesium helps to relax the uterine muscles, helps to reduce the cramping, and it can actually help with reducing those prostaglandins, those inflammatory chemicals. B vitamins help with hormones and detox, as well as they support mood. Iron is needed to support blood and reduce heavy periods. And vitamin D helps to regulate inflammation, insulin resistance, and helps to balance out hormones. And if your periods are heavy and painful, there's a really good chance that you are deficient in iron. And then having low iron can contribute to fatigue, dizziness, brain fog, and it can cause even more pain with the already painful periods that you have because the tissues are not getting enough oxygen. They're lacking that hemoglobin, that oxygen carrying capacity of the red blood cells. And then this just creates a vicious cycle. Low iron creates more blood loss creates less iron in the body, and then it worsens the periods for the next month. And we also need to talk about balancing hormones. So your hormones fluctuate throughout your entire cycle. Estrogen's high and low at specific points. Progesterone rises after ovulation during that luteal phase, and then drops before you get your period. And then having too much estrogen relative to your progesterone levels can cause a thickened uterine lining, which then can contribute to heavy and painful periods. And it can also contribute to breast tenderness and other PMS symptoms during your period. And what contributes to these hormonal imbalances can be stress, poor liver detox capacity, low progesterone levels after ovulation or potentially not ovulating at all, and insulin resistance, as well as a variety of other factors as well. Now, there can be conditions that actually cause structural changes to the uterus that can contribute to painful and heavy periods. Those would be conditions like endometriosis, fibroids, or adenomyosis. And fibroids are those non-cancerous growths that can increase bleeding with periods, they can increase clotting, and they often cause very sharp and intense cramping pain. Now, if you think you might have fibroids, you would want to get that checked out with a pelvic exam and some MRIs and or a pelvic ultrasound to assess the size of the fibroids and where their location might be, as sometimes surgery might be indicated for that. Other therapies as well. Now let's talk about what some things are that you can do to start improving those painful periods. Getting proper assessments done will be one of the first things that I often recommend. So getting blood work done, seeing if there's any insulin resistance, high inflammatory markers, or nutritional deficiencies such as low iron, low B12, or low vitamin D. Sometimes we will often recommend looking at your hormones as well at specific times in your cycle to make sure that they're at their levels that they should be. We'll also want to look at blood sugar levels and look at cholesterol markers because cholesterol is the backbone to building your hormones. Even though we look at cholesterol in terms of cardiovascular health, so heart health, we also look at it in terms of does your body have the building blocks to build the necessary hormones that it needs. In future videos, I will be diving into how you can take control of your health with reducing painful periods, but I definitely recommend just doing the foundations first and getting thoroughly assessed to see what areas need the most support. If you can take anything away from this video, I hope that you found out that although period pain is very common, it is not normal and it should be addressed. And there are a lot of ways that we can support reducing painful periods once we get to the root concerns, such as inflammation, insulin resistance, hormonal imbalances, and or nutritional deficiencies such as low iron, low vitamin D, B12, and other factors as well. And if you found this video helpful, please hit that subscribe button so I know to make more content like this for you.